basic things are lost and a patient is left struggling with breathing and is left flat. But we will also remind you that in positions like this, at Tafari, we will remind you that in positions like this, there is danger for patients developing pressure sores if they sat in those positions for prolonged periods of time. So at Tafari, we will take time to teach you the dangers of keeping patients in certain positions for prolonged period of time, and we will give you the alternatives. How do you position? Maybe you lower the bed 30 degrees, and then the patient can be able to ease the pressure and spread that pressure to other parts of the body. Critical. Otherwise, if you leave these patients to stay in this position for too long, first of all, the back will start to ache, pain, discomfort. So at Tafari, we will systematically, step by step, teach you how to care for patients who are going to be depending on you in this position, who cannot turn and position themselves. You're going to be, when you leave Tafari, you will know the ins and outs of how to provide the best care for that patient and why you do what you do. We will go through that. Feeding. At Tafari, we will teach you how to feed, position, and feed the patient. That you will be able to position. This is called the bedside table. Sometimes the bedside table is going to be one that you roll in and it goes in, and sometimes it's going to be the one that is just anchored by the bedside board like this. And we will be able to show you how to maintain patient dignity. Maybe we can use this towel. Before you start to feed, we believe in patient dignity. So don't go put the patient like that. The patient has a top like this, and your food all over them, and you bring a towel, now you clean like that. No. And now the patient is fed, but has all over food that was scattered around. And you bring that towel and you wrap like that. No. So it's Tafari, we will embrace the element of resident dignity, patient dignity, and as you can see, me and Dr. Lucy, we will teach you that we want you to keep patient dignity before you start to feed the patient. And then at the end, you know, as you feed the resident, the patient has food all over, and you just make them comfortable. And they feel, not leave the food all over, dropping down like a baby. And this is a lady, we call her Mary, we call her Lucy. So we want Lucy or Mary to feel comfortable and have dignity. What we have at Tafari embraces the element of respect, dignity, and that comfort. Those elements, if they are not embraced, then care is not care. I worked in a company that we said the mission statement was, we care and it shows. Now, if that care doesn't show, then it's no care. At Tafari, I believe I will pull that in. At Tafari, we care and it shows. So when you are out there in the name of Tafari, in the uniform of Tafari, let your care show. Don't just care. But I can say, I can see it, and it shows. That's what we want to show at Tafari.